The overall goal of this deep TMS protocol is to demonstrate how the H1 deep TMS coil can be repositioned on the skull to target different anatomical regions and disorders.
This method can help answer key questions in the TMS field, such as how to stimulate the medial prefrontal cortex or the temporoparietal junction if you only have the H1 coil.
The main advantage of this technique is that it is easy to apply and be confident that the targeted anatomical region is being stimulated since the coil is so large.
This method can provide insight into neural circuits of the specific symptoms treated. It can also be applied to other H coils and other conditions, such as using the H7 coil over the motor cortex to treat neuropathic pain or examine the integrity of the corticospinal tract.
Begin by placing the blue cap with the two intercepting rulers onto the subject. Then, place the 0 centimeter mark of the white sagittal ruler on the nasion and the 25 centimeter mark of the clear coronal ruler at 40% of the nasion-inion distance with the 0 on the left side of the patient's head. Use the helmet to find the resting motor threshold, or MT, of the right hand by starting with the front of the helmet 7 centimeters from the nasion and the left side of the coil tilted 2 centimeters to the right. Then, identify the minimal motor threshold, also known as the hot spot. Advance the coil 6 centimeters anteriorly over the nasion-inion ruler to stimulate the left prefrontal cortex. Finally, adjust the helmet over the left prefrontal cortex. Begin by pressing repetitive mode on the stimulator touchscreen. Then, enter the parameters by touching the boxes on the screen and adjusting them using the side wheel. Press Run Session. Charge the machine by pressing the green button. Warn the patient that the stimulation is starting. Then start the stimulation with the yellow button. Straighten the helmet in a symmetrical fashion over the motor cortex, or MC, with the 0 on the front of the helmet over the sagittal ruler so that the coil inside the helmet is over the MC. Advance the coil 6 centimeters anteriorly over the nasion-inion ruler to stimulate the left prefrontal cortex. Advance the tilted bare coil from the MT location over the motor cortex, or MC, to the left prefrontal cortex, or PFC, by moving it 6 centimeters forward along the sagittal ruler. Move the helmet 6 centimeters forward along the sagittal ruler from the motor cortex to reach the medial PFC while keeping the helmet symmetrical. Then, place the coil over the medial PFC symmetrically with respect to right-left, with the 0 mark on the helmet's front edge aligned with the 3 centimeter mark on the sagittal ruler of the cap. Next, find the left-hand empty hotspot by tilting the right side of the coil 2 centimeters to the left and watching the resting left hand. Following that, move the tilted helmet 6 centimeters forward along the sagittal ruler so that the coil within the helmet rests above the right PFC. Finally, place the helmet over the left temporoparietal junction by moving the coil 4.5 centimeters posteriorly and 6.5 centimeters laterally to the left shoulder from the right-hand MC hotspot. The position of the coil holds great importance, as in this case the medial PFC is clearly stimulated. However, this is not the same pattern of neuronal activation that is seen when the H1 coil is placed over the left PFC. This study with 30 PTSD patients who failed to benefit from antidepressants or psychotherapy indicated a significant improvement only in the group that received active dTMS after brief exposure to a script of the traumatic event, with a group-by-time interaction for the intrusion component of the CAPS.
Once mastered, this technique can be done in less than 10 minutes. The implications of this technique extend towards therapy of major depressive disorder, bipolar depression, negative symptoms of schizophrenia.
While attempting this procedure, it is important to remember that everyone in the room should utilize hearing protection to minimize the risk of hearing loss. Also, the subject's motor threshold should be rechecked at least once a week, or if any medications are changed.
After watching this video, you should have a good understanding of how to utilize the H1 coil for the treatment of numerous conditions other than major depressive disorder by moving the coil to treat brain regions other than the left prefrontal cortex.